If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Common cold. The common cold is a viral infection of your nose and throat, the upper respiratory tract. It's usually harmless, although it might not feel that way. Many types of viruses can cause a common cold. Symptoms. Symptoms of a common cold usually appear 1 to 3 days after exposure to a cold-causing virus. Signs and symptoms, which can vary from person to person, might include runny or stuffy nose, sore throat, cough, congestion, slight body aches or a mild headache, sneezing, low-grade fever, and generally feeling unwell. The discharge from your nose may start out clear and become thicker and yellow or green as a common cold runs its course. This doesn't usually mean you have a bacterial infection. Healthy adults can expect to have 2 or 3 colds each year. Infants and young children may have even more frequent colds. Most people recover from a common cold in a week or 10 days. Symptoms might last longer in people who smoke. Generally, you don't need medical attention for a common cold. However, if symptoms don't improve or if they get worse, see your doctor. When to see a doctor. For adults, generally, you don't need medical attention for a common cold. However, seek medical attention if you have symptoms that worsen or fail to improve. Fever greater than 101.3 degrees Fahrenheit lasting more than 3 days. Fever returning after a fever-free period. Shortness of breath, wheezing, and severe sore throat, headache or sinus pain. For children, in general, your child doesn't need to see his or her doctor for a common cold. But seek medical attention right away if your child has any of the following. Fever of 100.4 degrees Fahrenheit in newborns up to 12 weeks. Rising fever or fever lasting more than 2 days in a child of any age. Severe symptoms such as headache, throat pain or cough. Difficulty breathing or wheezing. Ear pain. Extreme fussiness. Unusual drowsiness. And lack of appetite. Causes of the common cold. Although many types of viruses can cause a common cold, rhinoviruses are the most common cause. A cold virus enters your body through your mouth, eyes, or nose. The virus can spread through droplets in the air when someone who is sick coughs, sneezes, or talks. It also spreads by hand-to-hand contact with someone who has a cold or by sharing contaminated objects, such as eating utensils, towels, toys, or telephones. If you touch your eyes, nose, or mouth after such contact, you're likely to catch a cold. Risk factors. These factors can increase your chances of getting a cold. Age. Infants and young children are at greatest risk of colds, especially if they spend time in childcare settings. Weakened immune system. Having a chronic illness or otherwise weakened immune system increases your risk. Time of year. Both children and adults are more likely to get colds in fall and winter, but you can get a cold anytime. Smoking. You're more likely to catch a cold and to have more severe colds if you smoke or are around secondhand smoke. And exposure. If you're around crowds, such as at school or on an airplane, you're likely to be exposed to viruses that cause colds. Complications. These conditions can occur along with your cold. Acute ear infection, otitis media. This occurs when bacteria or viruses enter the space behind the eardrum. Typical signs and symptoms include earaches or the return of a fever following a common cold. Asthma. A cold can trigger wheezing, even if you don't have asthma. If you have asthma, a cold can make it worse. Acute sinusitis. In adults or children, a common cold that doesn't resolve can lead to swelling and pain, inflammation and infection of the sinuses. And other infections. A common cold can lead to other infections, including strep throat, pneumonia, and croup or bronchiolitis in children. These infections need to be treated by a doctor. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.